Hi, my name is Scott Erlinger, and I'm with Lifetime Benefit Solutions, and I'm going to give you a brief overview of a health FSA. So let's start with the definition. What is a health FSA or a health flexible spending account? So an FSA is a special account where you can take money out of your paycheck to put into account to use to pay for certain out-of-pocket healthcare costs. Now you might ask, why would I do that? What's the real advantage? And the advantage is that you don't pay taxes on the money you put into your FSA. So effectively, you can reduce your taxable income by the amount that you put into this account. And this can have a significant financial benefit. Now, I find the best way or easiest way to really kind of understand or see this benefit is by walking through an example. So let's take an example. Here we have an individual who has gross monthly salary of $4,000. And on average, they have $200 in healthcare expenses every month and $400 in dependent care expenses every month. This individual does have access to a health FSA and dependent care FSA, but they have chosen not to participate. And so we can see we start with their gross monthly salary, which is also their taxable income. They have their taxes withheld. And then out of their net pay, they'll go ahead and spend their $200 and $400 in healthcare and dependent care expenses, leaving them with $2,584 of monthly spendable income. Over here, we have the same exact financial scenario, except this individual is or has elected to participate in the health FSA and dependent care FSA. So now we start again with the $4,000. But before we arrive at their taxable income, we have their FSA contributions come out of their pay. So you have the $200 and $400 go into the FSA accounts, and then you arrive at their taxable income of $3,400. What that means is when we take a look at, let's say, the federal income tax withholding, we go from $328 here to $256 here. So a significant amount less in withholding. And when you get to the bottom line, their monthly spendable income of $2,738 is approximately $155 more than in the other scenario. It's substantial, and when you think of it on an annual basis, it really is significant, of a more than $1,800 increase in spendable income for no other reason than one individual chose to participate in these programs. So if you can benefit from being enrolled in these programs, there is a significant financial benefit to enroll. So understanding the financial benefit, let's take an overview of the plans. So the plan works on a plan year, 12 calendar months, and it starts on January 1st. There is a runout period, and the thing to know about the runout period is that's just the time you have at the end of the year to submit a claim. So if you do have a claim towards the end of the year, let's say the last week in December, you don't have to rush to have it submitted for reimbursement. You have up to 120 days to submit that claim. There is a maximum contribution limit, and that can change year by year. So definitely take a look at U of our website to find out what your current max contribution is. And the eligible expenses are medical, dental, vision, pharmacy, and we'll take a look at those in a little bit more detail in a minute. Some additional key details is it's an employer-owned account. It's not portable, and effectively what that means is if you separate from service, you can't take your FSA account with you. It is COBRA eligible, so you could continue to use it during your COBRA eligibility period, but eventually you would have to leave it behind with your employer. It's funded through your own pre-tax payroll deductions each pay period. One of the great advantages of an FSA account is that you do have access to the entire FSA funds from day one of the plan year. So in this scenario, if you have a large out-of-pocket expense in the beginning of the year, maybe LASIK or orthodontia, you have access to your full election, even though those funds haven't come out of your account yet. You must enroll or re-enroll every year. So just worth noting, if you enrolled in a previous year, that doesn't carry over or you don't automatically enroll, you do need to go through open enrollment and enroll again. And then many of you have heard the term use it or lose it, which just means at the start of the year, or as you're thinking about the amount you're going to contribute in during the open enrollment time, you want to make sure you think carefully and choose an amount that you know you're going to use because you don't want to get to the end of the year and forfeit any funds. Your plan does have the carryover option, though, which is a great feature that allows you to roll over or carry over a portion of your year-end balance, which does make it a little simpler when you're making your decision to decide how much you're going to put in. So let's take a look at eligible expenses. Things like copays for office visits, we mentioned LASIK, laser eye surgery and orthodontia, prescriptions, vaccines, dental, vision treatment, eyeglasses and contacts, pretty much anything that is used to treat a specific medical condition. There is a full list of eligible items that can be found at our website. And one of the things we're really excited about starting in 2020 and carrying over into future years is that over-the-counter and menstrual products are now FSA eligible. This is fantastic because these are things that we all buy on a weekly or monthly basis to support our family. We think of the ibuprofen, the cough medicines, maybe something like Claritin for allergy medicine. All of that is now FSA eligible. Now, your plan does have something called automatic claims transfer, or ACT. And what that means is that when you go to a doctor or anytime that you're using your medical insurance and a claim is going to be filed from your provider to your health plan, that claim will also come to Lifetime Benefit Solutions. We have a claims file feed from your carrier. And when we receive that claim, we're going to be able to tell what your patient responsibility or out of pocket was. And as long as you have enough funds in your FSA to cover that amount, we will automatically reimburse that amount to you. So there's no action needed, no claim to file, nothing for you to do to prompt that. It works automatically, completely hands off, and it really is a great and easy way to be reimbursed through your FSA. Now, some key considerations. We do suggest that you sign up for direct deposit. That makes the ACT process work even better because your funds are just dropped right into your personal checking account. And you can sign up for direct deposit right on our member portal. Another thing worth noting is at age 65, we do have to turn off the medical claims or ACT transfer once you reach Medicare eligible age. So just be aware that at that point you would have to submit your medical claims. And then you should contact our customer service if you had any other medical insurance, such as Medicaid, that may cover a portion of your claims after they go to your health insurance carrier. So for any other claims that don't go through the ACT process, you do have to submit a claim request. Really easy, 3 different ways to do it. Online right on the member portal. You can do it right on your phone through your mobile app, or you can complete a paper form and fax or mail that to us. Just worth noting that however you do it, the claim must be accompanied by either a detailed receipt or an explanation of benefits from your insurance carrier. We've already mentioned the member portal and mobile app. This is a great way to manage your account, either right on your computer or right on your phone while you're on the fly. You can check your balance, you can receive alerts, file claims, and effectively manage your entire account balance through these options. We've already mentioned about claims processing. There is a customer service 800 phone number. It's available Monday through Thursday, 8 a.m. to 5 p.m. Eastern Standard Time, and Friday, 9 a.m. to 5 p.m. We do have an email address. If you want to send us an email, go ahead and do that, and we'll get right back to you. And then forms and more information is available on our website. We hope you've enjoyed this presentation and really seen the benefits of participating in a health FSA, and I thank you for your time.